Hello, my name is Gareth and this is my colleague Sarah. We're part of the pharmacy team here at Velindre Cancer Centre.
This video is about a group of medicines called tyrosine kinase inhibitors, or TKIs, which are taken by mouth as a tablet or a capsule and are used to treat different types of cancers. You can recognise them by their names, which usually end with nib. During this video, we will explain how to store and take your TKI medication, how to manage some of the side effects, when to take medicines to help with the side effects, how to stay well at home, and when you should contact us for advice. Sometimes, when you are unwell, you will need to get help and advice quickly, so we will explain who to contact and when you should do this. The most important thing to remember is that you are not a burden. We want you to contact us if you feel unwell, because the earlier we know about side effects, the easier they are to treat, helping you to stay well and stay on your cancer treatment. If you feel unwell with symptoms that are not explained in this video, it is important that you contact the treatment helpline straight away.
Your oncology team includes your consultant, specialist pharmacy professionals, nurses, and doctors. During your outpatient clinic appointments, your team will speak to you about your treatment and provide you written information. It's important to read this carefully. Reading it together with a friend or family member may be helpful. Write down any questions or concerns you might have and bring these to your next outpatient appointment to discuss with your team.
You should always store your medicines in their original packaging in a cool, dry place, below 30 degrees, safely away from the reach of children. Your pharmacy will let you know if your medicine should be stored in a fridge. Your TKI treatment will be given to you in medicine packs that will either be a pot or a box. Each of these will have a label printed on the outside to let you know how many tablets or capsules to take and how often you should take them. Always read the instructions. It is best not to touch your medicine, so take it by popping it straight out of the packaging into the medicine pot provided, or into a small cup that you keep specifically for taking your TKI and take without touching them. Always take with a glass of water, swallowed whole and not broken, opened or chewed. And be sure to wash your hands thoroughly afterwards. You may also be given other medicines to help manage the side effects of your treatment. Never share your medicines with anyone else, and any unused medicine should be returned to the hospital pharmacy for safe disposal. Do not start any new medicine or supplements while you are taking your TKI treatment without checking with your oncology team. This includes anything you may buy.
If you've taken more of your medicine than prescribed, contact the treatment helpline for advice straight away. If you're sick, do not take another dose to make up for it. Just take the next dose at the usual time. As a general rule, if you forget to take your dose but remember within 2 hours, then take it. But if it's more than 2 hours late, miss the dose and take your next dose at the usual time.
If you are not sure how to take your medicine, you can ring the hospital pharmacy or treatment helpline for advice.
Common side effects of TKIs include feeling tired, loss of appetite, feeling or being sick, also called nausea and vomiting, diarrhea, high blood pressure, sore mouth, and soreness on your hands and feet. Don't forget, if you are feeling unwell with symptoms that are not explained in this video, it is important that you contact the treatment helpline straight away. Feeling tired, also called fatigue, can have many causes. The cancer itself may make you tired, as can the treatment. This can be more noticeable if the medication reduces the amount of thyroid hormone made by your thyroid gland, or if it causes a reduction in your red blood cells, which is called anemia. Some pain medication can also contribute to fatigue, as it can make you more sleepy. Your team will speak to you about your energy levels before you start your TKI treatment. This will help them to monitor how you are feeling during your treatment. You will have regular blood tests. Your team will let you know if the results show lower levels of thyroid hormone or red blood cells, and how this can be treated. Carry out normal activities like getting dressed and washed if you feel able. Some people find it helpful to take small amounts of gentle exercise. This might be walking around the house or going outside when the weather is nice. Whatever you can manage safely. If you feel tired after exercise or normal activities, listen to your body and rest if you need to. If you don't feel better after rest, or you're spending more than half the day in bed, or unable to complete normal activities, please contact the treatment helpline. You may lose your appetite while on treatment. If this happens, try and eat small meals or snacks throughout the day to keep your energy levels up and to prevent weight loss. Keep a record of your weight at home and let your clinic team know if you are losing weight when you speak to them at your outpatient appointment.
The lining of your mouth is sensitive to TKI treatment, so it may start to feel sore a week or so after starting treatment, and you might get ulcers, also called oral mucositis. When you start treatment, you may be given mouthwashes to help keep your mouth healthy and reduce soreness. Use an antiseptic mouthwash, which may be provided twice a day to help keep your mouth clean. As soon as you start to feel any soreness in your mouth, start using an anti-inflammatory mouthwash called benzidamine. A common brand for this is Difflam. You can use this every 1.5 to 3 hours to help reduce the soreness. Brush your teeth regularly with a soft toothbrush to prevent hurting your gums as they might become sensitive. Use a lip balm to keep your lips moist and to prevent cracking. And try to avoid hot, spicy foods and drink plenty of water to stay hydrated, which will help prevent drying in your mouth. If you have soreness in your mouth that is making eating and drinking difficult, please contact the treatment helpline.
TKI treatments can cause you to have diarrhea. If diarrhea goes untreated, it will cause you to lose lots of fluids, which will make you feel weak and unwell. So if you have diarrhea, start to take the loperamide provided. Take 2 loperamide at the onset of diarrhea, then 1 after each loose bowel motion, with a maximum of 8 in 24 hours, and this can help to settle the diarrhea symptoms. Until your symptoms settle, avoid fresh fruits and vegetables. Try and drink extra fluids to help stay hydrated. Avoid alcohol and caffeine. Alcohol is dehydrating and caffeine can stimulate your bowels, so they could make your symptoms worse. Please contact the treatment helpline if you have more than 4 episodes of diarrhea in 24 hours, despite taking loperamide, or if you have cramping pains in your abdomen, or if the symptoms last for more than 1 day.
Your treatment can cause the palms of your hands and feet to become swollen, red or painful, and can sometimes cause pins and needles or a loss of feeling. Use a non-perfume moisturiser regularly to prevent your skin from drying. You can buy some from a supermarket or pharmacy, or get some from your GP or oncology team. If your skin starts to become sore or red, try and avoid allowing your hands and feet to get too hot or cold. Wear gloves outside on colder days and protect your hands if you are getting things out of the freezer or oven. Avoid very hot baths or showers and moisturise your hands and feet after washing them or getting them wet. And wear comfortable shoes to avoid damage to your feet. If your hands or feet are cracked and painful and it is affecting your ability to walk or is making tasks like doing up buttons difficult, please ring the treatment helpline.
Feeling or being sick, also called nausea and vomiting, can be a common side effect of treatment. It can make you lose fluids and make you feel tired and unwell. When you start your TKI treatment, the pharmacy team will make sure you have a supply of anti-sickness treatment. So if you feel nauseous, start taking your anti-sickness tablets according to the label. Avoid fatty or fried foods. Eating small meals and snacks and drinking plenty of water can also help to settle your symptoms. There are lots of medicines that can treat and prevent sickness. So if one medicine is not helping you and making you feel better, let your oncology team know, and they can prescribe a different treatment that could be more helpful for you. If you are sick more than once in 24 hours, if you are not feeling better after a day of taking an anti-sickness tablet, or if you've not been able to eat and drink, please contact the treatment helpline.
Your blood pressure may increase when you start TKI treatment, and this is a common side effect. It's important to treat high blood pressure because over a long period of time it could affect your heart or kidneys. Before you start treatment and while you are taking your TKI, you will have your blood pressure checked regularly. Blood pressure checks can be done during your outpatient appointment with your oncology team, at your GP surgery, or at home if you have a blood pressure monitor. If you are using a home blood pressure monitor, record your results and show them to your oncology team at your outpatient appointment. If your blood pressure has increased, you may need to start blood pressure lowering treatment, which will be taken as a tablet or a capsule.
There are some rare side effects, which if they occur you must seek urgent medical advice. Contact the treatment helpline straight away if you notice any of the following symptoms. If you have a wound that does not heal or is becoming painful. If you have pain in the mouth, teeth or jaw, swelling or soreness inside the mouth, numbness, feeling of heaviness in the jaw or loosening of teeth, these could be signs of a rare side effect called osteonecrosis, causing bone damage in your jaw. Pain in your abdomen or fever and feeling sick. These could be signs of a rare side effect called gastrointestinal perforation, which is a hole that develops in your stomach or bowel. Uncontrolled bleeding, vomiting blood, black stools, bloody urine, headaches, coughing up blood, feeling drowsy or confused or finding it difficult to concentrate and new headaches, swelling, heat, redness and pain in your calf, or new worsening shortness of breath, any of which could be a symptom of a blood clot. Remember, if you're feeling unwell with symptoms not explained in this video, please contact the treatment helpline.
If you are unwell, contact Valindra and ask for the treatment helpline. You will find the number on your alert card. If you have any general inquiries about your chemotherapy appointments, contact Valindra and ask for the booking line. If you have any general queries about your clinic appointments, contact Valindra and ask for your specific consultant secretary. And if you have any general queries regarding your TKI medication, contact Valindra and ask for the pharmacy or the treatment helpline if the pharmacy has closed.
We hope you found this video helpful. We can't list all the side effects from your treatment, so please visit the Electronic Medicines Compendium for more information about side effects.